We have a heads up today for anyone nearing retirement age or even starting to think about what retirement may look like. It's a gentle reminder that could wind up saving you a bunch of money. Gilmore Jason Mahler CPA Charlie Hyde is here to explain what we need to know about signing up for Medicare and some hefty penalties you may not know about.
Right, Amanda. I mean, this is something that I think everyone just needs to be aware of. So we're talking about the group today of people who are approaching their 65th birthday and are still working, and they plan to continue to work because they get their health coverage through thetheir employer.
Right. So
that's the group we're focused in on.
It's very complicated. You know, you got the parts A, B, D, you know, all of the different parts. Can you break this down for us, for folks who haven't quite figured it out yet?
Yeah. So let's start with the fact that I'm approaching 65. You have an enrollment window that you've got to be aware of, and that is a 7-month window that surrounds your 65th birthday month. So it's 3 months prior to when you turn 65, and it's 3 months after the month you turn 65. That's your 7-month window in which you would enroll in Medicare. So then just overall, I think the big thing to think about is Part A, Part B, Part C, Part D. Part A is what is free. Everybody gets it. If you've worked for 10 years and paid in with Medicare taxes, that's the hospital coverage. That's the assisted living coverage, home care coverage. Part B is what everybody's going to pay for, even in retirement. And it starts with a minimum premium, and then it goes up based on how much income you have. And that is your traditional doctors, you know, what I'm going to call outpatient type services.
Okay.
Then Part C is where you combine A and B together in an Advantage plan. And then Part D is prescription drug coverage.
Yeah, we know that's important for a lot of seniors. So I had no idea that there were penalties involved if you enroll late. I didn't know you have to do it by a certain time. So let's talk about these penalties.
Yeah, so and the first thing is these are lifetime penalties. So if you miss your enrollment for Medicare, it's 10% penalty for each of the 12 months that you were late in signing up. That's important to know. And there's also a 1% penalty on the prescription drugs portion of Medicare. So it's, you know, the key is that's why we wanted to get this out for people to realize as I'm approaching 65, I've got a very important decision to make regarding my health care and Medicare, because you don't want to get hit with these penalties that would last the rest of your life.
Yeah, so let's get back to those turning 65 then. Would you say, hey, maybe they're covered by a spouse, by their employer's plan? Would you still say, hey, you should enroll for this? What do folks 65, about to turn 65, need to do?
Yeah, so the people that are about to turn 65, you know, the first thing is, if I'm working and I've got my coverage at work, is my employer a large employer or a small employer? And for this purpose, it's defined as greater than 20 employees, large employer. Less than 20 employees, small employer. If you're working for a small employer and you're approaching 65, you're going to want to sign up for Medicare, both A and B, because Medicare becomes the primary insurance, and whatever insurance you would have with your employer becomes secondary. If it's greater than 20, your decision tree is, what kind of insurance do I have with my employer, a large employer? And what I mean by that is, do I have a high deductible plan with my employer that I'm contributing into an HSA plan, savings account? If I'm doing that, even if I sign up for Part A, which a lot of people do, you know, they sign up for Part A and delay Part B until they retire full time, I cannot contribute to that health savings account. And that could be a big portion of what people plan into their health care spend and plan.
So a lot of things for folks to consider, and it's probably individualized for a lot of people too. They have these individual scenarios. So if
Yes.
they've got questions, best to contact your human resources department, check with your health insurance company so
Right.
that you make the best decision. But great advice for bringing this up for folks as they have a lot of decisions to make as they get ready to retire, Charlie.
They do.
All right. Thank you so much for joining us today.